In this video, we'll explain how you create an ultrasound after the 20th week of pregnancy. Everyone can make an ultrasound, especially after watching this video. The only thing you need is a little patience and some practice. It's going to be your first time after all. Get comfortable and pull up your shirt. Stuff some tissues in your trousers to keep them clean, and keep some on hand to clean up when you're done. This is the probe. It's the device's camera. Always keep your thumb on the marking on the side so you don't accidentally hold the camera upside down. It will help you prevent looking in mirrored image and getting confused. Apply a generous amount of scan gel on both your belly and probe. Too little gel will result in poor picture quality. If the probe doesn't glide smoothly across your belly anymore, simply apply some more gel. Your uterus and baby are quite big now. The further along you are in your pregnancy, the higher you can start looking for your baby. Because your baby has grown quite a bit, you'll see their hands, feet, heart, fingers, and even their nose. Move the probe in slow oval motions until you see something recognizable. Sometimes the view gets better when you tilt the probe or turn it vertically. The further along you are, the less pressure you have to put on the probe. Your baby will be closer to the surface. Do make sure the probe is in good contact with your skin to ensure the picture quality is as good as it can be, especially when you're not getting a clear picture. When you're just starting, it can be a little tricky to know what to look for. Luckily, there are some easily recognizable features. The white spots are your baby's bones. The bubbles you can see are usually the hands or feet, and a large circle is your baby's head. If your little one's position is favorable, you can even see the eyes. If you're close to the end of your pregnancy, your baby might have already turned, so you can find their head in your lower belly. The black areas are cavities with fluid, like the stomach, bladder, and heart chambers. The amniotic fluid is also black. If you see a blinking spot, you've found the heart. So beautiful. In the early stage of your pregnancy, you can see your baby in its entirety. Obviously, the further along you are, the bigger your baby will be, so you'll get to enjoy different things. How well you will be able to see your baby depends on a couple of things, like your body fat percentage, the location of the placenta, and your baby. If your baby is asleep just when you wanted to play, you can try waking them up. Try to cough, or gently wiggle your belly up and down. You can't get a clear picture. Try again later. If it really doesn't seem to work, contact us as soon as possible and we'll be happy to help. Clean the probe with a damp cloth or a tissue after each use. This will help you get a clearer image the next time. Never rinse the Babywatcher or use alcohol. This will damage it. Remember, the Babywatcher is meant to experience something wonderful during your pregnancy. Listen to your body and don't use the Babywatcher for medical purposes.